So guys, you'll have about a minute to go over all your equipment and make sure it's all there, everything you need. Make sure you have your BSI on. Make sure the scene is safe. Approach the patient and check for responsiveness. If they're unresponsive, call for ALS. Alright. Look for breathing via chest rise and fall. Check for a pulse for no longer than 10 seconds. They'll have a pulse, but they will be apneic, not breathing. Open the airway with a head tilt chin lift. Right? When it's open, you're going to see emesis or blood. We're going to need to provide suction. Right? So hook everything up appropriately. Make sure all the tubing is not kinked. Attach it to your Yankower. Hook up the canister to the actual suction device and then turn the device on. Make sure the suction's working. Alright, you're going to provide suction on the way out of the patient, alright, for no longer than 15 seconds for adults. The airway is going to be clear now. Patient's still not breathing, so we want to use an airway adjunct. We're going to start with the OPA, the oropharyngeal airway. Size it up from the side of the mouth to the angle of the jaw. If it's too small, go for something a little bigger. As we insert it, we want to go upside down. The tip is going to pass the roof of the mouth about halfway down the OPA, and then you flip it 180 degrees. All right. I want you to also try the NPA, the nasopharyngeal airway. You measure it from the side of the nose to the angle of the jaw. Once you have the right size, you're going to use bevel towards the septum, which is the middle of the nose, and we're also going to lube it up. All right, bevel towards septum. Start with the right side, the right nostril. It's typically a little larger in diameter. Let's also try the left nostril, okay? So bevel towards septum, and once the tip of the NPA passes the top of the nose, you're going to rotate the NPA 180 degrees. Now remember, the patient is still not breathing. Hook up the BVM to high flow oxygen, 15 liters. Use that CE grip and head tilt chin lift and bag every 5 seconds, all right? 10 to 12 ventilations per minute. All right. You're going to verbalize that you applied a pulse ox to the patient, and the proctor is going to tell you that your pulse ox is still around 75%, right? It's inadequate. Our local protocol will tell us that we can insert a supraglottic airway device, a king airway, and there's 3 different sizes, number 3, number 4, and number 5. Just think, if you're going to use the size number 3, our patient is 4 to 5 feet, so 1 number above the size. We're going to test it, and while we're testing, our partner is pre-oxygenating the patient at a breath every 3 seconds. All right. We're looking for any leaks within the king airway. No leaks. We're going to lube it up. When we're ready, we're going to remove the OPA, open up the mouth, provide a tongue jaw lift, and insert the king airway until you meet resistance. Inflate the cuffs, remove the syringe, attach the calorimetric device. It measures carbon dioxide, all right? It helps us confirm placement. Attach the BVM and bag at every 5 seconds, all right? So bag, 1, 2, 3, 4, bag. Okay, and we confirm placement by listening over the epigastric sound and then both lung sounds with our stethoscope. Looking at the calorimetric device, gold color change is good. Look at the skin parameters, the pulse ox should be improving.